Hi everyone, thanks for being with us again today for another one of our expert chats. Today we are really excited to focus on some cool work happening in the pharmacy field. Today our guest is Dr. Chephra McKee from TTUHSC, Abilene. We're so glad to have you with us, Dr. McKee.
Thanks, I'm excited to be here.
So tell us a little bit about your Texas Tech journey. We like to hear how you got there and you know, sort of where you came from.
Absolutely. So I am not from Texas or West Texas. I'm from Mississippi, actually. I grew up there. My family's back there. I actually went to school at Ole Miss, or the University of Mississippi. I did both my undergrad and my pharmacy school at Ole Miss. And then I went to residency at Children's Hospital of King's Daughters out in Virginia Beach. Well, Norfolk, but most people know Virginia Beach. And then I really started looking for jobs after, or like as it was getting close to it. And Mark Hasse, who's in our pharmacy department in Amarillo, reached out to me and asked if I'd be interested in this job. I said, absolutely. And we joked that I used to say, I can live anywhere for a year. I'll just go live in Abilene for a year or two and then maybe move closer to home. And I've been here now 6 years. So no intent on leaving anywhere. I've loved working for Texas Tech and moving here. So it was a great option.
Isn't that funny how many of us say that? And then
yeah, absolutely.
To stay.
Right.
So tell me a little bit about what, is happening in Abilene right now. You've got the Doctor of Pharmacy, the Pharm.D program there. We kind of like to hear, since we have several campuses all over the state, we like to hear kind of what the atmosphere is, particularly in reference to COVID and sort of just in general. How's Abilene feeling right now?
Yeah, I think most of us in Abilene would say we really miss each other. We would love to be back in our offices. So as you can see right now, I'm still working from home. We have an anticipated date of July 6th, trying to get back into our offices. But I know me personally, I miss seeing my students. I miss being able to see them. A lot of us, we haven't seen them since March whenever we went all virtual. And so it's been kind of tough for us, but we have three major schools here. So we have the School of Pharmacy, the School of Nursing, and then the public health program that are on this campus. And so we really have tried to work together during all of this time, really connecting with the other faculty as best as we can, doing a lot of virtual meetings and things like that. We've been really lucky here in Abilene in terms of COVID. We only have about 250 positives in total here in Abilene, so that's compared to our population quite a low number. And I don't know if it's because we're just such an island out here compared to everywhere else, or maybe just other people haven't gotten tested or things like that. The ones that might not have as many symptoms, potentially just not knowing that they have a positive case. So we've actually been really lucky that we've only had about 250 here in Abilene.
Well, I know that across the state, we are sort of watching and waiting to see how the secondary spikes are going to happen. So we will keep an eye on it in Abilene. But in the interim, one of the things that we've talked about is children and the interactions with children and COVID. And, you specialize in pediatric pharmacy. So what have you guys in the profession kind of approached? How have you approached treating children in the pharmacy profession, especially with COVID on everyone's minds?
Absolutely. So again, we've been really lucky that children aren't ones that get, or not a large portion of ones that get COVID, and those that have gotten COVID are generally have a pretty good course. They're not as sick, which I think us in the pediatric profession is really exciting, because most of the time whenever our kids get something, they get it really worse than everybody else. So I think that we've been lucky in that instance. But I think we're taking all the same precautions that we would for an adult. So where I work at Hendrick Children's Hospital, we are wearing masks all the time, both us as well as the patients, and then also if they have a caregiver. We're also limiting the number of people that are able to come into the hospital, so each of them only get one caregiver at a time. The parents can switch out as long as they aren't COVID positive. So we've been doing things like that, wearing eye shields, and then in the clinic that I also work in, we've been doing the same thing. So wearing eye shields, wearing masks, doing our best to stay 6 feet apart. washing your hands often, using hand sanitizer, those types of things. So we've been doing a lot of similar things that we would do with our adult population as well as our kids, because just because they haven't been getting it as much or it may not be as severe doesn't mean that we don't want to take the same precautions.
Is there anything that parents should really be thinking about, or healthcare providers should be thinking about when it comes to treating and COVID-19 in younger patients, and really things to look out for?
Yeah, a lot of the same types of things. I have a lot of friends that ask me this question that have small children, like, oh my gosh, what should I be doing? And I tell them, it's very similar to the adults. Just keep an eye on them. If there's anything that you're concerned about, especially breathing issues, call your pediatrician. If you ever have that inkling, that I call it your mommy gut feeling or your daddy gut feeling that something's wrong, call your pediatrician. And if they feel like after talking with you that you need to be brought in, they'll do the appropriate thing and bring you in. So I think that's important. And one thing I've also been telling a lot of my friends is talking with them about what COVID is. A lot of them haven't seen their friends since schools went virtual, and your younger kids, you might think, oh, they love being outside and playing, which is a great thing. Don't get me wrong. I love having them outside and playing, but they tend to miss their friends, and they may not know how to express that and express those emotions because they're just not to that point. And so I think having sit-down talks with them about, are you missing your friends? How are you feeling during this? And really explaining what this is. It's a little difficult, but there's a lot of good resources out there online to talk about how to have those discussions with your children. And I think that's one that we often forget about, is that they don't quite understand what COVID is, or they don't understand, why can't I go to my best friend's birthday party, or why can't I have my birthday party? Those can be kind of tough for them. So I think that's one thing that we don't always think about when you're thinking about your adult population, is definitely having those discussions with your kids.
For sure. And I kind of want to shift now to a focus on, I guess before I started with Texas Tech, I didn't realize that there were subspecialties within pharmacy, right? We have geriatric pharmacy, pediatric pharmacy. I think a lot of people don't realize that. I kind of want to talk about what that means, what your day-to-day looks like, outside of COVID, and, somebody who might be interested in this sort of specialized field.
Absolutely. So there is, of course, pediatric pharmacy, and then what also tends to blow people's minds a little bit is there's subspecialties within pediatric pharmacy as well. So on my day-to-day, when I am in the hospital, we actually have a level 3 NICU here in Abilene. So I round with our physicians in the NICU, as well as our nursing staff, respiratory staff, everybody who goes on rounds with us, and we round on each individual baby. And in that instance, I do a lot of looking at the medications that we're prescribing. Are they appropriate for that patient's gestational age, their weight, all of those, big things that are important, because compared to the adult world, children, their organs aren't quite mature, or they are maturing. They're all different weights, they're all different sizes, they're all different ages. And so one medication that's okay for maybe a 12-year-old may not be okay for a 5-year-old. So I do a lot of that, looking into those, giving dosing recommendations to our physicians. I do a lot of counseling as well for our patients. So I really like to get the children involved in that. So, I start around the age of 4 or 5. I start including them whenever I'm giving them counseling recommendations, because if they buy into why they're taking a medication, then they're going to be able to take it a lot more than just the mom or dad forcing it on them. So I think that's important. So I do a lot of education for them as well, as being a resource. I help out also with some of our, if our nurses have questions about, compatibility issues, that type of thing. So that's kind of my inpatient side. And then I also do outpatient pharmacy, which is not sitting in a pharmacy. I know that sounds silly, but I'm actually in a clinic, in an outpatient clinic. So we see a number of different subspecialties, endocrine, pulmonology, hemonc, are just a couple of the ones that we see. So for that instance, I do a lot of helping manage their medications. So looking at their medications and saying, is there something that maybe we can alter to make it easier for you to take this? Or are you having problems taking it? A lot of times people might just say, are you on any medication, and move on. I really dive in and ask, how often are you taking it? Are there any adverse effects or something that may cause you not to be taking this medication. Those types of things, those questions, I really dive more in depth into that. And then especially for our pulmonology and our endocrinology patients, really asking, demonstrating how they're doing their inhalers or injecting their insulin to make sure that they're doing it correctly, because a lot of people, don't watch it on TV. They'll tell you the wrong way to do something. So I like to have them demonstrate for us to make sure that we're actually giving them, that they're doing it correctly. And then making any adjustments to their medicines as needed. So as they grow, as they get older, making those recommendations for our physicians is something else that I do. So kind of a lot of things that you can do in the pediatric world within pharmacy.
I can tell you're super passionate about it too.
Yeah, I love my job.
That's so cool. Another big part about pharmacy, and I know something that you're real passionate about, is immunizations. And as we sort of get through the summer and start to think about going back to school, this is a big topic, especially this year, because we're talking about a COVID vaccine. We're also talking about making sure and getting those flu shots ahead of an intense flu season partnered with COVID. Parents out there probably have a lot of questions about immunizations. It is a controversial topic for a lot of people. Can you kind of give us some advice for parents out there if they're wondering how to go about immunizing, what to do, when to do it, all of that business?
Yeah, absolutely. I think immunizations are really important. We know that they're safe. We know that they're effective at preventing preventable diseases. That's why they're called them that. So I think they're really important. I also think it's really important to listen to the family and ask why they aren't wanting to get their immunization. It may be something as simple as, they had a really bad reaction to this one, and that's why we're not giving it. Okay, that's a simple answer, and I don't want to subject a child to something that's going to cause a bad reaction again. But if it's just because they don't understand it, or they may have some misunderstandings from different areas, I think that's really important to ask that question, because then we can educate them. We can answer those questions that they have about it. And I think a lot of parents are scared to ask those questions. It's easier for them to just say, no, I don't want an immunization, than to ask, I heard this has mercury in it, or I heard this has whatever, or causes insert other random disease they think it causes. So I think it's important to sit down and listen to them and ask those questions, and then to answer them and make sure that their concerns are heard. And then find a way to maybe be able to come to a way that we can get this kid these immunizations. I think the flu immunization is really important, the flu shot. So I think it is important that everyone gets it. As for the COVID vaccine, I can't wait to see what comes of it. And in terms of, safety and efficacy studies, I think it's important that we look into that and just say, did we test it in any children? Is it going to be safe in children? So without just blindly saying, yeah, absolutely, give it to all these kids, I think it's important to know those types of things as well. So I think really just having a conversation is the best way to handle immunizations with families.
Having a discourse with your physician or your pharmacist is super essential.
Absolutely.
Well, very good. Okay, Dr. McKee, anything to add on the topic before we go to our lightning round?
I can't think of anything. I don't know.
Well, are you ready for the lightning round then?
I hope so. I'm not sure.
It's the most famous, the most famous Facebook Live segment in all 50 states. It's remarkable how popular.
I'm excited for it.
Yeah. Okay, so I'm going to ask you a series of questions, and you just got to go with your gut and tell me what you think, okay? First question is a tough one. It can be a little bit of a stumper. Crunchy or smooth?
Smooth.
Good girl. Okay, ice cream favorite. What's your favorite ice cream flavor?
Ooh, I think it'd have to be a tie between either Ben & Jerry's Half-Baked or Ben & Jerry's Americone Dream. Both of those are really good. I don't know if I can decide.
You're providing excellent answers already. We're already best friends. Okay, pineapple on your pizza or absolutely not?
I go in between. I'm not going to take it off if it's on there, but I'm also not going to order it if I'm in charge of ordering it. So I'm not anti it, but it's not my favorite.
That's fair. Okay, what is your spirit animal? If you were to give yourself a spirit animal, what is it?
I'd have to say an otter, I think.
Okay, otters are cute.
Yeah, I'm really like high energy, like go, go, go. If you've ever done the Enneagram, I'm an Enneagram 7. I'm like always all over the place. And I think that's kind of what otters are. They're also one of my favorite animals at the zoo when we go to the zoo. So
cute. I need to add an Enneagram question to the lightning round.
good.
Reminding me. Okay, last question. Anything that you're binging right now, Netflix, Hulu, that you're loving, that we all need to try?
So I was joking with my friend the other day. I think I found the end of Netflix. I feel like that's all I've done during quarantine. I would say one of my most recent ones that I've loved is Sweet Magnolias on Netflix. If you haven't seen it, highly recommend it. Maybe it's just me as a Southern girl loving it, but it was really great. And there's only one season out so far, so it wouldn't take very long either to binge watch it.
It's pretty warm and fuzzy, that's for sure. So that's good.
Yes, yes.
Well, Dr. McKee, thanks for being with us today. It was wonderful to talk to you. You really educated me about a lot of stuff. I bet a lot of people learned something from you today. So thanks for being with us.
Thanks for having me. I loved it. Appreciate it.